Do they have an office? Do they have a license? Are they an actual doctor or a self-proclaimed doctor? Right? That's really the difference, because the accountability and responsibility when you are a true doctor is different than when you are an entertainer calling yourself a doctor.
This is the Visible Voices podcast. I'm Dr. Resa Lewis, emergency medicine and lifestyle medicine physician, medical educator, and your host. This show is about making healthcare more equitable, one visible voice at a time. Today, I'm joined by Dr. Geeta Nayyar, physician technologist, rheumatologist, and former CMO at Salesforce and AT&T. She's now a fractional CMO and strategic advisor to health tech companies. She's the Wall Street Journal and USA Today best-selling author of Dead Wrong, Diagnosing and Treating Healthcare's Misinformation Illness. She calls herself a builder of the trust bridge, the connection between technology, care delivery, and the patient experience. Dr. Geeta Nayyar, welcome to the Visible Voices podcast.
Thank you so much for having me, and congratulations on your book and your podcast. This is wonderful.
I often speak with friends who are also physicians about my experiences with my elder parents. And I say, it should not be a determinant of health that your child is a doctor. Can you walk us through your decision to become a rheumatologist and how it relates to your mom?
So my mom actually has a very rare autoimmune disease, and I spent a lot of time, we're a South Asian family, so everybody goes to the doctor with mom, dad, brothers, and myself. And so I always grew up going to the doctor with her, and we were always left hanging, right? There was this just, we're not really sure, could be this, could be that. And it was always very mysterious. I obviously did a lot of reading. When I got into medical school, that is really when I decided to dedicate my career to rheumatology. My mom's disease was also progressing. And really, by the time I became a rheumatologist, my mom was really dying and in very, very bad shape.
For how many years would you say she lived being misdiagnosed?
I mean, her whole life. My mom, gosh, this started when I was young, so she was young. She was in her 30s and 40s, and now she's 80. 20, 30 years, half a lifetime.
And when you started getting medical knowledge as a medical student going through residency, how did they receive you posing questions or pushing back on the diagnosis of we don't know?
So her case was genuinely complicated, right? So it's not that these were bad doctors or doctors that
Sure.
didn't know what they were doing, or even cocky for that matter. But she had a complicated diagnosis. Her disease was quite nuanced. And at that time as well, to even find an autoimmune specialist was also quite difficult, right? And if we think back on innovations, now we also have a lot more diagnostic techniques, a lot more therapeutic techniques. Again, very easy in hindsight to see the simplicity of things. The access issue was certainly real, and the knowledge and innovation and the space of rheumatology was still continues to evolve and grow. But it was tough, and I would say it was tough for two reasons. So one, you have to remember that I was a child myself. As a rheumatology fellow, I was 20 something. I was about this big. I didn't speak nearly as confidently or loudly as I do now, right? I was sort of still like kind of been a doctor for 5 minutes, right? What I did know though is my mom. But I think for a lot of doctors, particularly the ones who had seen my mom for a long time, like all of us, when we see a patient for 20, 30 years, it was sort of like, this is your mom's disease. This is how it behaves. So I think that's one. But two, the humility of being able to entertain a new diagnosis. And this is why I think it's so important when we think about second opinions, right? And I'm a rheumatologist. If I have a patient who says, I'm just not happy with this treatment or diagnosis, and they ask me about a second opinion, I'm always the first to say, absolutely, that's what you want to do. No harm, no foul. My ego is not bruised. And I think that's perhaps the biggest piece that I learned also as a young doc, is there wasn't really an appetite for entertaining that I could even possibly be correct. And I remember fighting with several, and it really was fighting, because at this point it was also all very emotional. And I just remember saying, if it was your mom, do the test. Like, we're paying for it. We have insurance. Like, just do the test. I'm happy to be wrong. And I remember saying that all the time. I'm happy to be wrong, but I cannot watch my mom go through this and think that I did not unturn every stone and any possibility. But that was always where the rubber hit the road.
Ultimately, though, you called up one of your mentors.
I did not have the right avatar to get it done. Like I understood that no one at this point, I very much understood my place in medicine. We're so good about the hierarchy. I mean, I was at the bottom. I was not a full-fledged rheumatologist even. I was a fellow, a first year fellow. And I called my chairman, Dr. Katz, who's the chairman of rheumatology at George Washington, where I was trained, and we owe him everything. I said, Dr. Katz, I know what the diagnosis is, but here's the thing. And I presented the case and I said, no one will believe me. Can I bring my mom to DC and can we just do it? Can we just get the biopsy? Can we just do all the things? And he said, of course. Bring her up. And that's where the story began and ended. Dr. Katz really saved my mother's life and
Yeah.
entertained the diagnosis. And I think for anyone listening, perhaps that's part of it, is to just, sometimes you have to get out of the institutions you're at and the doctors you've seen and go somewhere with fresh eyes and a fresh perspective.
And what would you offer as a lesson for the listeners who their child is not a doctor or they're not sure how to do that advocacy for themselves or for a family member because they don't feel they have agency?
I think the first thing you have to do is really partner with the doctor that you trust. The truth is the healthcare system is so complex. The information, even if you read it and you are not a clinician, is really hard to understand. A doc that you really, really trust is important when you are healthy, when you are actually not even sick, is really critical. But then you kind of have to have the fortitude to ask the right questions and be very smart about what you are reading, because there is so much mis and disinformation out there. And I think one of the most understated things that we never talk about is you have to have your records. You must have your records from beginning to end. Do not assume anyone has your records. Do not assume they have it from this facility or that facility. Even if they have the imaging with all the tech in the world, what do? Did you bring the CD?
Exactly.
Did you bring the CD?
Ex-
I may or may not actually be able to read that CD as well. So it's the basics, but you
Yep.
got to have your records. You got to have as much knowledge as you can, the right knowledge.
So you were an early adopter, I will say, of the MBA, but also of the pivot into health tech. When did you know that, I think clinical medicine has its place for me and in my professional journey, but I'm really interested in this health tech thing?
So I definitely did not. So I was a baby doc. I got into medical school when I was 17. I wanted to be a doctor. That was it. That was the dream. And that was what I had dedicated my career to. It was very much an accident to fall into health tech. So I'll tell you, first came the MBA, tech came second. So I did the MBA actually during my fellowship, believe it or not. Again, same chairman, Dr. Katz, supported me and allowed me to do that. Um, and really what inspired that was my experience with my own patients and constantly fighting with the administrators on why I wanted to keep someone in the hospital, right? Or why I wanted a social work consult.
So did you get an MBA because you thought it would equip you to better navigate the business of healthcare and as a physician to advocate for your patients?
Yes, and more than that, the language. Because what I realized in every one of those encounters with administrators is they spoke the language of finance and business, and I did not. And I
Hmm.
would be speaking to them in French and they would be speaking to me in Spanish, and we would never find a solution. And then you get labeled certain things, right? Especially as a female doc. But I never backed down. And when I got my MBA, that was my intention. I was like, you know what? This is about common sense. I don't know what language these people are speaking. I'm going to go learn that. And that's what I did. Now, in that time period, that was the time when GW and so many hospitals started to follow the High Tech Act, right? And we started to get our electronic medical record. And because I was in business school, I don't know that I would have thought this way if was just doing clinical medicine, but I very much started to understand the business case for digital health and health tech. And then clinically, I understood this would be better. It would be better if we could actually get the records. It would be better if we could do telemedicine. It would be good if we could actually get some data and analyze patients and actually predict things. Now, obviously, we still have a lot of work to do in that regard, but at that time, that was pretty revolutionary, right?
Yeah.
And there was really no doctors that were interested in anything like that. And I still remember when I decided to kind of pivot to health tech that so many colleagues, mentors, friends told me that I was throwing my career away
Mm.
and that it was a huge mistake and no one was ever going to take me seriously as a doctor. And I was so young. Was I sure this was the pivot, that I wanted to make? And it was hard. It was hard because I didn't actually know the answer. I just was making a bet on what I thought the future was going to look like.
And how did it turn out?
I mean, of course, I have no regrets. I mean, I'm so proud of the work I've been able to do. I'm proud of the impact I've been able to make in healthcare and ultimately to patients that navigate the system. But I do think we have so much work to do. I mean, we still have not gotten the basics right. And I think that's the biggest lesson on this end of the journey is that, you know, And now it's AI. I mean, AI is not going to help us open that disk or that image.
Yeah.
Like, we have data sharing issues, we have interoperability issues, we have trust issues. So we still have to do the hard work in healthcare. The innovation's there, the tech is there. If we wanted to do these things, we could. But for all the reasons you understand, we're not going to. So that's where the consumer has to be savvy and smart. And we have to continue to push our institutions to be better.
You've compared AI to a hammer. You can build with it or you can break it.
And you just have to understand, again, AI is a phenomenal tool. It's incredibly exciting to think about all of the things we can do with it. And I'm incredibly excited to be working on some of those innovations. But again, the basics of sharing data, the basics of we have data gaps. I mean, we don't have a lot of data, or the data is sitting on the fax machine, right? That's how we communicate a lot in healthcare. And so being able to understand the limits of the tool are just as important as understanding the promise of the technology.
Yeah. And arguably with AI, we have to be even more fastidious about misinformation. So, for the audience, can you give a working definition of misinformation and disinformation?
You bet. So misinformation, I like to say it's like you just missed the facts, kind of like a rumor, right? You heard something, you assumed it to be true, and potentially you passed it on. So that's misinformation. Disinformation is actually more dangerous, and it's actually the one that we need to be more worried about. So disinformation is the intentional spread of improper facts with the intention to dupe or manipulate or benefit in some way, whether that's financial, political, so on and so forth. But disinformation is actually organized, orchestrated, and intended to fool you.
Can you give a specific translation of the definition to an example? Say, if we were to use vaccines or something from COVID in terms of misinformation, disinformation.
Sure. So, misinformation, again, you just got the facts wrong, right? Somebody said don't wear a mask. A mask is gonna suffocate you, and the chances of you suffocating from your mask are higher than from COVID. So don't wear a mask, right? Just something insane that somebody came up with and just got it wrong, right? Or masks are only the right mask is only available here for X amount of money, blah, blah, blah. Disinformation is actually what we see every day in America today, which is like the politicization, right? The polarity of where we've had these conversations. If you truly are a good American, you will not get vaccinated because the people trying to vaccinate you are trying to harm you in some way or have a different value system than you do. And it is a total disregard for the facts, right? And so the people that are benefiting off of that, whether that is a media platform, whether that is an influencer trying to have you subscribe here and evoking this emotional reaction from you that's like, yes, I am a good American. I will subscribe here. And of course, I will not get vaccinated, right? So it's that kind of organized, thoughtful messaging with a complete disregard of the facts or presentation of the facts that is scary and is what is happening today.
So, dovetailing off that, why is it important that we as physicians are speaking up and in more public facing spaces to combat disinformation and correct misinformation?
Number one, I think as a result of the mis and disinformation out there, as healthcare institutions have lost trust. So whether we are talking about hospitals, payer, life sciences, med tech, doesn't matter which institution of healthcare, we as institutions of health have lost trust by the consumer. Public health organizations, they're simply not in a stature of trust the way they used to. The one person that people still trust is their physician. We know physician burnout is real and remains here. So on top of the 10 things you need to get done in a visit, that work of articulating science and medicine in a relatable, approachable way is very difficult to do in 8 minutes,
Yeah.
right? If you spend the whole 8 minutes having to debunk myths, it becomes very difficult to actually manage your diabetes or actually manage your hypertension or your lupus, right? And so so I say that with the humility of saying part of the answer is that physicians who articulate, such as yourself, must be out there evoking science and inspiring science in others. But the reality is, we as a health system need to make that easier, right? We need to, number one, we have to reimburse people for their time and their expertise. Two, we cannot be held liable. I mean, a big part of why we don't see the everyday doctor on the same social media platforms is everyone's so afraid of liability, right? And or the perception in the profession of, oh, you're now marketing or you're now an influencer, that's somehow tarnishing you as a physician, right? So there are many things, whereas at an enterprise level, where I think the answer really lies is, how does a hospital make it easy for their staff to be debunking mis and disinformation, whether that is social media assets, whether it is uncuffing all of the things around liability and these platforms and saying, we're very proud of our docs. Here you can find them. Kaiser Permanente, I recently did a grand round for them. They have a TikTok channel, believe it or not. Kaiser launched a TikTok channel that they manage, that they do all the work, and their docs can come on and talk about what they do every day, whether it's colonoscopies, whether it's screening for skin cancer. And I love to use them because it's fantastic what they've
Yeah.
done. And somebody in legal and compliance got out of the way and said, hey, our docs are wearing our t-shirt.
Yeah.
Why would we not be promoting their expertise and also paying them for their time and making it easy for them, right? We can't now ask doctors to be marketers.
Yeah.
And so I'm very careful with that messaging, that we're not giving doctors one more thing to add, one more non-reimbursed thing to add to their plate.
I shared with you one of my aha moments in terms of physicians speaking up and being part of the conversation to help combat disinformation, misinformation, was a conversation I had with Claire Wardle, who's a communications expert. And she said physicians need to be where patients and people are. And she pointed to, similar to your TikTok Kaiser reference, she pointed to the Children's Hospital of Philadelphia and their education information that's freely available and online. There are ways to vet and make it legal in terms of liability and protections to get this information out there in a very productive way. How do you think about your responsibility as a physician communicator? And have you had any of that pushback that you just shared?
I feel very passionate about the space, and a big part of my journey in health tech has been watching all of this unfold. And I think there are so few healthcare leaders in the space that have a clinical background, that really are as close to the issue and can zoom in and out in a way that I can and enjoy doing. So I continue to think this is the right path for myself, and I continue to hope to inspire others and hopefully lay forth strategies that I think enterprises can use, right? It can't just be an N of one of someone on TikTok, right? It has to be an enterprise system solution. And actually, you mentioned it, right? Having the chief marketing officer and the chief medical officer work together, coming together with an enterprise strategy, whether it's an omni-channel approach, and how are we texting patients before they get to the doctor? How are we creating social media content that's generated from the enterprise, that's validated, highlighting individual doctors, nurses, et cetera, team members? That's really what it takes. And that's really where I'm focused, is how do you use these innovations? And AI is one of them, right? AI can be a great tool to help look at information and know if it's correct, right? Even using AI to just say, hey, is this right? Show me, are these the facts? And then, similarly with algorithms and communication on social media, being out there and being able to say, this is the correct use of AI in healthcare versus the opposite.
Geeta, when did you realize you had a voice, and when did you start using your voice?
My goodness, that's like a big question. I think that probably, I've always had kind of very externally facing roles in enterprises that I've worked in, but I think I always assumed that was the power of the seat I was in. In other words, it didn't really matter who was in the seat, right? Anybody that would have been in CXO role would have had the same microphone, if you will. So I don't think that I ever actually really felt I had a voice until I left the corporate role and really took a leap of faith and wrote my book, and then created my own seat and my own platform. But it's been fairly recent, if I'm honest, right? I would say in the past 3 years since I started my business and became independent, that I feel very lucky to be wearing my own t-shirt and my own microphone and kind of being out there. And I take it as an important responsibility. I'm not I don't take it for granted, and I'm thoughtful about the things I do and the things that I choose to pass on, if that makes sense.
For people listening, I'd love to leave them with some microskills, some small intentional actions they can take based on our conversation, based on your expertise and your work. So for the doctors, people that are considering speaking up, getting engaged with speaking on misinformation, what's one small intentional action they can take today if they want to move into this space?
I think doctors, we overthink this. You just have to start. The truth is you have to start. And this is one of the biggest things I've learned as an entrepreneur and as someone in tech. No one waits for it to be 100% perfect the way we do in medicine, right? 70%, 80%, you're good to go. So I would say you need to just start. You need to constantly be learning and evolving, which we as doctors are very good at doing. And it's interesting how many people ask me about communication and where did I learn to be a speaker and all these things. You know where I learned it? On rounds. I
Yeah.
mean, every morning we get up and round and we
Yeah.
have to present to our team, our group, and half the time we haven't ate, we haven't slept, right? I mean, who's getting up and doing a keynote and hasn't ate or slept? Very few people. And the stakes are arguably much, much higher in medicine on rounds than it is doing a keynote. So I would say don't overthink it. Just start. You present every day, very technical things. What we're talking about is actually keeping it simple, keeping it to the point. Pretending the audience is not doctors, because that's the other piece. We're so good at talking to other doctors. You got to kind of take that hat off and pretend you're talking to your neighbor, right? And you do that, and you do that every day with patients. But I think intentionally saying my audience is my neighbor, this is something we do every day in medicine, whether we're presenting to another consultant, the team, the families. We as doctors are always communicating. So I always, when I hear that from other colleagues, but partnering with the chief marketing officer, partnering with communications and saying, listen, this is not my area, but this is where patients are coming to me with some crazy notions that they found on TikTok or some other venue. And I need your help. I need your help because medicine, communications, marketing, it's a team sport, but raising your hand, working with other teams to partner on the issues of the day that docs and nurses have can often be some of the most impactful work you can do.
Any micro skills for people that are listening that are wondering how to identify misinformation? They really want to make sure they're trying to get trusted resources in terms of healthcare and education and information.
Well, you got to check the source. There's no question. You got to check the source. You need to then validate it with other sources, right? If there's an evidence-based standard and the AAP is saying, hey, this is the standard for how we do X, Y, and Z. Does it match what your source is saying? Two more points. One is if you follow this information from the source, right? What is the gain to that source? Are they asking for a like? Are they asking for a subscribe? Are they asking for a credit card? These are often, okay, this source is now not the source has lost credibility, right? What is the mission of the group? And one of the biggest sources I feel that we don't reference enough as docs helping navigate our patients is patient advocacy groups. I mean, there are entire groups whose only mission is to help patients with diabetes, to help the Lupus Foundation. Their entire mission is to help patients with lupus. Those are the kind of groups, right? Patient advocacy groups that have amazing information, relatable, approachable, factual, and they're not asking you to subscribe or like or for a
Okay.
credit card. They're mission-based organizations. That entire role is to advocate for patients. And I think too often as docs, we should be pointing at those groups as the sources of truth.
I love that.
And I would say, and social media is here to stay. We're all on it. We all have our own favorites. Whoever you follow, tell your patients. I follow a few rheumatologists, and they, when they say, who should I follow? I say, well,
Yeah.
you should follow real doctors that you can make an appointment with, that have a license, that won't be saying things that are not true. And here's a few that I follow.
Yeah.
And, if you're interested, have at it. They're my
Yeah.
friends.
That's a
Absolutely.
great idea. Follow the people you trust follow.
Absolutely. And in the clinical space, there's a lot of doctor TikToks out there. But what I would say is find out, do they have an office? Do they have a license? Are they an actual doctor or a self-proclaimed doctor? Right? That's really the difference, because the accountability and responsibility when you are a true doctor is different than when you are an entertainer calling yourself a doctor.
Yeah. Geeta, for people that want to follow you and your work and see what's up next for you, what's the best way?
Oh, I'm on all the platforms except for TikTok. So I'm on LinkedIn, Facebook, and Instagram for now. And I would love to continue the conversation with you and your listeners.
Sounds great. Dr. Geeta Nayyar, thank you so much for joining me on the Visible Voices podcast.
Thanks for having me.
The Visible Voices podcast amplifies voices in the healthcare, equity, and innovation spaces. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Find me at Resa E. Lewis MD on social media or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by hosts and guests are their own and do not reflect those of their employers or institutions. Guest appearances do not imply endorsement of any product, service, or organization. Information shared here is intended for general informational purposes only, reflects the time of recording, and should never substitute for clinical judgment or individualized medical advice. No physician-patient relationship is created by listening to or watching this podcast. Together, we're making healthcare more equitable, one visible voice at a time.